A traditional Western diet is usually a low-fat diet. Because it's a low-fat diet, this automatically often creates a higher carb diet. The Western diet, the majority of the macronutrients, over 50%, are usually carbohydrates. Carbohydrate is actually not an essential nutrient. We can produce glucose, which is a carbohydrate, if we ingest fat and protein through a process called gluconeogenesis. Because of this process, gluconeogenesis, where we can actually produce glucose, carbs become non-essential as long as we're supplying what is essential. Many people have heard of essential amino acids and essential fatty acids. In nutrition, when we say something is essential, it means that it's essential for the survival of the body, and it's essential because the body cannot make that molecule from other molecules, like, for example, glucose, that can be created within the body from other material, such as protein or fat. While, of course, the issue of calories plays a part in obesity, if we have a significant excess of calories, energy, it will be stored in the stored form of energy, which is fat. If we have a significant deficit in calories, yes, we will lose weight. However, limiting the idea of weight gain and weight loss and limiting that to merely calories is a pretty vague, is a pretty juvenile, is a way of looking at obesity that is quite superficial. We must look at the hormonal implications of what we eat. We are not what we eat. We are what that food becomes when we eat it. And different macronutrients can have a very different hormonal response in your body that is independent of calories, that can play a role in obesity. Many say that glucose is the preferred source of fuel. And it's true that when you ingest a carbohydrate, immediately the priority is to use carbohydrates as a fuel. I don't consider it because it's the preferred fuel. I consider it because the body likes to keep a blood sugar level within a very narrow margin. And when we ingest carbohydrates, it goes way out of that comfort zone for the body. Therefore, the body will always use the glucose to return it to a normal level. We see this with alcohol also. When alcohol is ingested, the body stops burning any other macronutrient and right away burns the alcohol because it's a toxin. It wants to get rid of it. So the rationale that carbs are the preferred fuel, because it seems like the body always jumps on it the minute that it's introduced, has nothing to do with that being a preferred fuel. And we know that the body kind of sees it like it's an emergency situation. That's why insulin, the hormone that will shuttle that sugar out of the bloodstream to within the cell to produce energy immediately or be transformed into adipose tissue. The reason that sometimes insulin overshoots and actually lowers blood sugar below normal, making hunger arrive relatively quickly after a carb meal, is because when you have a really big carbohydrate load, the body panics and just like secretes as fast as possible a large amount of insulin because it wants to return it to normal. Because in the past, you guys have seen that I've showed you that high levels of glucose is very inflammatory, is very damaging, it's very irritating. The body doesn't like these glucoses that are high, out of the normal range. You see this with high carbohydrate diets. However, as we're going to speak of soon, we will speak of the low carbohydrate diet, which automatically increases the amount of fat in that diet. This diet is superior for several reasons. First of all, because a low carb diet does not introduce carbohydrates, or it's extremely restricted, the access to your fat storage becomes very easily accessible, because we tend to lock ourselves out of fat storage when we spike our insulin, or if we have carbohydrates within the body that, like I just mentioned, the body will want to burn first. Because you have an easy access to your fat storage, because carbohydrates are no longer present, fat becomes a source of fuel for your body. And the easy access to your fat storage decreases your hunger level. Although you're not eating perhaps a high carb meal every 5 hours, you have a constant access to calories because you're not locking yourself out of your fat storage, because you're creating a low insulin environment, because you're not using carbohydrates. Fat becomes a primary fuel. You become a fat burner. However, since you've been high carbohydrate all your life, and within your cell, the little unit called a mitochondria that produces the actual energy with glucose or fat is not calibrated. It's not adapted to start using efficiently fat for fuel. Therefore, there are symptoms that can occur when you start a ketogenic diet or a low carbohydrate diet. A ketogenic diet, by the way, in case you don't know that term, is a low carbohydrate diet. When you restrict and you do a low carbohydrate diet, you are nourishing your body with calories through fatty acids, but some of those go to the liver and produce a molecule called ketones. It's the fat version of glucose, and it goes and supplies, for example, the brain. 70% of the brain can be supplied with ketones. If you're transitioning from a traditional low-fat diet to a low-carb diet, I'll go through the steps of what's exactly going to happen within your body and why these processes of adaptation can bring on symptoms. The first thing, when you're eating a high carbohydrate diet, you're using glucose as a primary fuel. When you're ingesting carbohydrates, the energy is used immediately for your cell to produce energy. Also, there is limited space where glucose can be stored for later time. This is called glycogen storage. Glucose, when it is stored, is attached to water and is placed within the liver and your muscles. These are glucose reservoirs, glycogen storage. When we restrict the carbohydrates over the next 2 days to 3 days, mostly by 48 hours, you've gone through all of the reserves of glucose in your body. Remember that glycogen is glucose plus water. When that stored glucose gets used, water is eliminated. The loss of this excess water through urine also expels a lot more of our minerals and electrolytes. Primarily, sodium, potassium, and magnesium are the primary electrolytes that may vary during the adaptive period. The first is low sodium. So because you're peeing so often, you're gonna tend to pee out more sodium. Also, a low carbohydrate diet that produces a low insulin environment has a direct hormonal effect on your kidneys, which causes the kidney to excrete more sodium. A high carb diet, the kidney and the body through the kidney retains sodium. With a low carbohydrate diet, it excretes sodium. So not only do you have to increase your salt intake, your sodium, when you're on a ketogenic diet, and stay well hydrated initially because of the diuretic effect of the glycogen being depleted. So due to the electrolytes, as well as your body adapting to be more efficient at using fat for daily energy as a primary energy source, because of these two issues, you can have symptoms arise on the internet. People often refer to it as the keto flu because you're feeling under the weather. Because you're not producing energy as efficiently as you will down the road in the coming weeks, you might feel a bit weak, less energy, less motivation. You may feel a bit forgetful and cloudy, low mood, as well as nausea sometimes can occur because you're really, completely doing a rehaul on your macronutrients. So, somebody that completely reduces one macro and starts introducing more fat, there's an adjustment period. Some people might get anything from diarrhea to constipation. So there is a change in your digestive tract that is also temporary. People also talk about symptoms like a fruity breath, which I personally have never heard anybody get. I have never experienced it, but people in ketoacidosis will get this because of such a high ketone level and a dehydrated effect. So they'll have a fruity, alcohol-y almost smell. This technically, I'll throw it out there, could happen. All of these are temporary. All of these can be fixed with an appropriate hydration, a increase in salt. You can supplement with a multivitamin. You can supplement with magnesium if you wish. Magnesium, one of the symptoms of a lower magnesium are muscle cramps, especially in your calf muscles. So if you're getting any muscle cramping, then possibly during the transition period, just take more salt and maybe 500 milligrams of magnesium supplement when you're feeling cramps. Overall, that's pretty much the transition. We're using a completely new fuel. This is a minor adjustment period for such a complete rehaul in how your metabolism is going to produce energy. So it's called the keto flu. There's an adaptive period. Concentrate on the salt intake, the hydration, guys. If you're feeling weak, if you're feeling brain fog, up your fat. Sometimes medium chain triglycerides, MCT oil, a little tablespoon of that when you're feeling foggy in your coffee or just by a spoonful will produce ketones fast during the adaptive period. That'll help with the brain fog. The most common symptom, in my opinion, is lightheadedness and dizziness, especially when you're going from sitting to standing. That is easily remedied by, again, salt. Eat salt. So salt your food. Don't be scared to salt your food. Go with your taste. And if you are experiencing specifically the symptom of lightheadedness and dizziness, grab some salt. Okay, it puts on some pink salt rocks or something, and just take a few of those rocks and drink it down like a pill. That usually will fix it. Don't forget that the cramps is because of the magnesium, so maybe supplement with magnesium. Keep in mind, all of these things vary from individuals. Doesn't mean you're going to get these symptoms, as well as keeping in mind it is temporary. So really don't cheat at start if you want to try this keto phase, because you don't want to stay in that gray zone where you did it a couple of times, you're starting to be in ketosis, your body's kind of trying to work with these ketones and fatty acids primarily, and then you cheat and then you're off for 3 days and then you're back. You're never going to get adapted, and you're just going to always be in this gray zone where you're not adapting and you're kind of in this brain fog and dumb phase. So you really gotta commit yourself if you really want to go through this adaptation and metabolic change that will, in my opinion, improve your life drastically. Thanks, guys.